Dr. Kevin Kavanagh of Health Watch USA come back to join us. Dr. Kavanagh, good morning.
Oh, good morning, sir.
Dr. Kavanagh, after we talked on Wednesday, sent me a couple of notes. Here are some things we could talk about on Friday. And this is just how fast things keep changing in this story, because we'll get to those stories eventually, we think, but other things keep popping up in the meantime. One of those,
I know.
Of course, the big one that is making headlines this morning is the fact that a military valet who is physically close to President Trump, we assume because of their job duties, has tested positive for the coronavirus.
Well, I mean, that's a huge story, and there's several learning points there. One is that the White House is testing everybody every day, or almost everybody every day. If you come in to see the president, you get a test. And I myself would like that sort of testing for me and my family. And certainly we need it for a lot of our frontline businesses, including our food handlers. Certainly need it for nursing home staff. So we don't have enough testing. The other is the narrative that, well, this is just the flu. And that's a false narrative. This is much more deadlier than the flu. As you can see from the reaction of the White House, they are extremely concerned. Now, this valet was serving food to the president. He was in a position where he could spread the virus. And remember, you can spread the virus up to 48 hours before being symptomatic. And that's called being pre-symptomatic. It's a little bit different than an asymptomatic carrier that just spreads the virus and does not get sick. So the White House has, I don't think, been using really good masking and distancing. Hard to do that with the way the West Wing is even constructed. And because of that, they're at risk, and they will be getting tests quite frequently now and hoping very much that the president and vice president do not come down with this.
President and vice president were tested immediately after the valet was diagnosed. I understand they've been tested daily, and at least one news source said now they may up that to twice a day for the president and vice president.
Well, yes, and this is another thing that people need to take home, is just because you have a negative test, if you don't have symptoms yet, you still may be in that incubation period of the virus. Thus, getting the test would become positive then later on, even though you had a negative test before. So just because you've had a negative test doesn't mean you don't have that virus if you've been recently exposed. The test is best for when you have symptoms or to pick up what's called asymptomatic carriers. So it is a good idea to get a test if you think you've been exposed at some point. You could be an asymptomatic carrier. But just getting a test and thinking I'm out of the woods, that's not the case. This is a dangerous virus.
We had a texter earlier asking how Kentucky counts positive cases, and let me just read from the text to you and get your response. Previously, a positive patient got tested and tested again until that test came back negative. In the hospital, that happens daily, and it would all display as a single case. But the system they're using in Virginia would indicate every single test, if it was positive, as a separate case, rather than all of them as a single case, which would falsely inflate the number of COVID-19 cases. Are you aware of anything like that happening?
No, I'm not. Most health departments will investigate and take out duplicates. You need to realize there's usually two separate arms. One's a billing arm for the hospital, and the other is when you put in a case report, and usually that's done by your frontline staff, doctors and nurses. I would not think that they are counting cases based upon tests. That I would almost be certain that that's controlled for. Because when you put in a report, again, that's frontline staff, more information goes in than just a case or just the test. So they keep track of age, race, sex, a number of different patient parameters go in, and then the health department would investigate if there looks like there's any aberrations. And of course, when we get into case tracking, and we already have that now, they would go in and investigate the case and then track it. The data that we get and use is based from the public health departments. And a lot of the national tracking sites, such as Worldometer, takes this off the state health department's websites. So the data that we're getting, if anything, is an underestimate, because if you die in a nursing home or you die at home, a lot of people are not going into the ERs and hospitals, especially in areas that are being overrun with the virus. Those cases are missed and not counted. In New York, they used to have approximately 20 people that died at home, and now during the COVID-19 epidemic, that's jumped up to 200. That's either a direct result from the virus or from what could be called, I hate to use the term collateral damage, but I mean, people that have true heart conditions aren't going in to get treated. They're dying at home rather than going in. And so unfortunately, that is also happening in some of our areas where the healthcare system's being overrun.
Right. We've also heard on that kind of subject, we also hear some people say, well, why do they count certain deaths as coronavirus when the guy had an underlying heart condition? And the best explanation I heard finally came this week. Yes, he had a bad heart, but he would have kept living if he hadn't gotten the coronavirus. He had this underlying health condition, but it was the coronavirus that did him in. Is that a decent explanation for us lay people?
Well, that's a very decent explanation. And you always hear these causality arguments. As the cases mount, there's really a desire by our leaders to mitigate the epidemic because of accepting responsibility. And this is true in every epidemic. So I wrote an op-ed on this in the LA Times, May 2nd of last year. That's true of every epidemic. And one of the major ways it's done is causality. Well, if you eliminate everybody that has an underlying condition, heart disease, hypertension, elderly, et cetera, then pretty soon you're left with maybe 10 deaths. Well, that's ridiculous. We need to look at premature deaths. And this epidemic is so great that what you're going to start to see is research looking at total expected deaths in our nation versus total deaths that we're seeing. And I think you'll find that number is going to be even greater than the numbers which we're talking about.
Dr. Kevin Kavanagh from Health Watch USA is with us. Let's focus on things a little closer to home for a few minutes, Dr. Kavanagh. And let's start with Senator Rand Paul making headlines this week for saying he doesn't need to wear a mask. He's already had COVID-19. Therefore, he's immune.
Well, I respectfully disagree with that. You always are accused of being a fear-mongerer, but when you have people that are not really following closely the science, you have to explain the concerns, and of course that can cause fear. But these are just concerns. The major one is that we don't know how long immunity will last with this virus if you get infected. And there have been reports, one out of, for example, Korea, where 90 patients were documented that were initially negative, and then they started to shed the virus after that. I don't think that happens often, but it could happen. But even more concerning is that there's now a second strain of the virus. It's 614G. The other strain is called 614D. 614G started to become prevalent in the United States, in mid-part of last month, mainly on the East Coast where we're at, and they think that's the virus that's infecting the Northeast. That virus has a mutation at the viral attachment protein. It's where you get your antibodies to, and it's more infectious and maybe even cause more severe disease. It's the virus that's associated with these rare conditions that we're hearing about children. And it's not known that if you have immunity to the D variant, if that will work on the G variant. It's similar to the flu. You can get one strain last year, still get the infection the next year. So this is not wise. And the wearing of masks is not to protect yourself. It's if you are an asymptomatic carrier to protect other people. So some states are requiring masks, such as Massachusetts. And the governor of Massachusetts, Charlie Baker, is a Republican. He's requiring masks. Tom Ridge, who is the Secretary of Homeland Security under George Bush, wrote an excellent op-ed in the USA Today that was really chastising people that were demonstrating against these stay-at-home orders. and really discussing on how John McCain spent 5.5 years in the Hanoi Hilton for our country, and people are putting our nation in peril because they object to being on their couch in their home for 6 weeks. So this is something that we really need to do. It's not a Republican-Democrat issue. This virus is not going to respond to talking points. At the very least, we need to slow down its spread to make sure that our tests and the vaccines can catch up to the virus and that we can be able to adequately and accurately detect it, and that when the vaccine comes out, it's not only safe, but it's effective.
Let me follow up here. You said earlier that we don't know at this point how long any immunity may last in those people who have had COVID-19. So what does that do then to the theory of herd immunity, that if enough people have had it and now are immune to it, that will protect everybody?
Well, first of all, it's a false narrative. This virus is very infectious. Unmitigated estimates have been it has an R0 of 5.7, similar to smallpox. And Peter Navarro said that January 30th that this virus may be as infectious as smallpox, and that's to a memo to President Trump. Our Vice President, Pence, said that it was 3 times as infectious as the flu. That would have an R0 of 4. You would need greater than 75% of the population to be immune before herd immunity would even start. The epidemic would still spread. It would just start to burn out. So almost everybody would be infected. But if your immunity lapses or a new strain develops, then you go through the whole thing again. And remember, this is a coronavirus, the same virus that causes the common cold. Well, I shouldn't say same. I mean, it's a little different, but it is a coronavirus. And our immunity to the common cold lasts approximately 1 to 2 years. So this is more severe. Hopefully the immunity lasts longer. But most experts do not think you're going to develop lifetime immunity like you get with the polio virus or the measles virus. So the herd immunity theory is really a false narrative, and people need to concentrate on slowing down this spread so the vaccines and the testing can stay current and catch up.
I thought of a specific name while you were talking earlier that I hadn't heard mentioned, if at least in a while. So maybe, and I know history isn't your field, but maybe give us a bit of a history lesson, because I'm thinking when we talk about asymptomatic carriers, wasn't the most famous asymptomatic carrier of anything ever called Typhoid Mary?
Yes, and that's correct. And that was a huge problem. She spread this to a lot of individuals. My understanding is they were never able to cure her infection. They had her under forced quarantine for a number of months or even years, and there was a lot of ethical debate over that. I mean, it's not something that needs to be done lightly. And it's fine to hold the governor's feet to the fire saying, do we need to do this? What should we do? We really need to consider and talk about this. But to go out there and demonstrate in a fashion where you're not social distancing, you're not wearing masks, that is just irresponsible. No matter what choice is chosen, we're not going to have an outcome which is going to be good. I mean, we're going to go through an ordeal and we're going to pay a price, and we really need to back the decisions of our leaders, because one thing that I'm convinced of, if one part of the nation or our state does one thing and another part does another, then no strategy is going to be effective. I mean, it's hard to open up an economy just in one county. You depend on other people in other counties to do trade. Likewise, this virus doesn't respect geographical boundaries. It easily spreads from place to place. So unless everybody's on the same page, it's probably not going to have an effective strategy for anybody. So we really do need to rally behind our leaders and follow their advice. I think that is extremely important.
Dr. Kevin Kavanagh, HealthWatch USA. It's healthwatchusa.org. We're out of time, Doc. Thanks a lot. Jack will be back with you next week.